Hi, Wellness Crew. This is Jenna L. Tripp, and I am laughing hysterically because I literally just recorded this video, but the microphone was off. So at least I got like a practice round in, right? um, Today, though, I want to talk about something that happened. And so basically, I got a phone call, and on that phone call, they confirmed to me that with my lab results, that I do have lupus. Now, in the past, it's been confirmed with an ANA that I have an autoimmune issue. But there's that second test that has to be done in order to identify what autoimmune issue you have. So obviously, this was not news to me because it's been something that's been on multiple doctors' minds since I was 19 years old. But I didn't know anything about that until years later, like much after 19. I think I was in my late 20s because I was finally looking through like all my medical records and stuff. And I was like, lupus? What? Because my current doctor was saying, I think you have an autoimmune issue. So finally, after a lot of like kind of ridiculous, stuff, we finally have a diagnosis. And I'm not celebrating it or anything, not like that at least. Um, but I'm just saying, like, with lupus and stuff, it's so good to know what you have. It's always good to stay on top of the whatever it is that's going on, right? So that way you can learn best how to manage what you have. So today's episode is called Lupus and Staying Confident and Positive. Okay. So lupus is also called SLE, which is systemic lupus erythematosus. Sorry, I'm not always the best with my handwriting, so excuse that. Um, but basically, so stuff like that people with lupus need to avoid is sunlight. Oh, which kills me because of yoga with Jenna. I think like if I wear maybe just like long sleeves and like leggings and stuff, I think it might be enough sun protection. We'll see. I'm risking my lives for you. I'm just kidding. My lives, my life for you. I'm just kidding. Um, but yeah, avoiding sunlight's one, so I have to be a vampire. I'm just kidding. Garlic and alfalfa sprouts. I love garlic. I could care less about the alfalfa sprouts, but I love garlic, and I'm like, why? Oh. I told you we're vampires. Oh. And I don't mean to make light or make fun of having lupus. This is just my way of processing the information. This is my way of staying confident that everything's going to be okay. And this is my way of staying positive about the whole thing. So I do like to be silly and joke around, but I do not in any way, mean to um, be insensitive to people that have it and that are struggling with it and that are dealing with a lot of symptoms right now. I'm just lucky that I don't have like a billion symptoms that I'm dealing with right now. Okay. So people can experience pain in the muscles, which is definitely something I experience. There's been days when like I haven't worked out and then I'm like, or like not days like in a row, but like a day, right? And then I'm sore and I'm like, I didn't even work out. What happened? So now we know why. um, Let's see. Pain types. You can have a sharp pain in the chest. So I've experienced this before, and at first it was a little like kind of shook me out of like what was going on. I was like, this feels really weird. It doesn't, for me at least, it doesn't feel like I'm gonna have a heart attack or anything like that. But it's still kind of like that's a sharp pain in my chest. That does not feel great, you know? So I just try to like breathe through it. That's all I can do. The whole body, there's anemia, fatigue, fever, or malaise. Um, I'm not anemic. That's what the labs also came back with. But I definitely deal with a lot of fatigue. So again, it's just pushing through, um, but also knowing like when I need to stop, you know, definitely knowing when I need to rest because if I take like more rests like in between the stuff that I'm doing, then that tends to kind of have like it makes me have a smoother day for sure. And one where like I still get to keep my energy up and I still get to be myself, you know? So, um, fever as well is something that I do deal with, but they're typically like low grade. Occasionally I'll get spikes, but it's not anything too insane. It doesn't go too high above 100. So people may experience in their mouth dryness or ulcers. Um, Dryness for sure, but I think it's also probably a side effect of something that I take as well. So I don't, I mean, it's really not that bad. And there's like mouthwashes and stuff that you can use for dry mouth. There's, drinking more water, staying hydrated, putting liquid IV inside of your water as well. I love liquid IV, and the hydration that it provides is insane. And no, I'm not sponsored by them. Okay. Um, let's see. So then there's also like inflammation of fluid, red rashes, and scaly rashes. So this happens like to your face. Um, the inflammation stuff with me, we've seen it. So yeah. Um, but the scaly rashes, the rashes, I can only imagine what that must be like and how difficult that must be to live with. So my heart goes out to anyone with lupus that deals with that. People may experience with their hair loss or loss of scalp hair. I have experienced some hair loss, but thankfully I am half Hispanic and have very thick hair. So I got it from my mama. So, it's gotten like a tiny bit thinner, but it hasn't gotten like crazy thin or anything like that. But it's still something that sucks because, to lose your hair is just like, ugh. But I guess for me, if I started like to lose a little bit, like I would just like cut my hair and do something totally like radically different with my hair rather than try to keep it on, like this long. um, so other common things that people may experience are anxiety, blood in urine, clinical depression, face rash, flare, headache, joint stiffness, um, sensitivity to light, swelling, water retention, or weight loss. So I've experienced most of those things, for sure, anxiety and stuff. But I do have something for that, so it helps for sure. um, the flares, the joint stiffness, the headache, absolutely. Um, the swelling, and then the water retention, or weight loss. So I went one day on the scale from 109 pounds to the next day being 117 pounds. And I was like, what is this? This is insane. I didn't do anything different or whatever. But I guess it just must have been like water retention and stuff like that. It's just one of those things. So, I guess I'm just going to have to kind of be understanding of my body. Like, okay, even if you work out and do this and that, you're still going to, have that fluctuation because of inflammation stuff, because of water retention. So, again, I just stay positive about it. Because I always think about, back in like August and in January where I was weighing like 150 or 160 pounds. So, or last January, obviously, not this January. So, there's always like ways to kind of look at things like, oh, okay, let me put that in perspective, in a positive and confident perspective, for sure. All right, 80 to 90% of people with lupus can expect to live a normal life. So what that means is like a full life. Um, 80 to 90%. That's great. That's like a great outlook. um, medical science has not yet developed a cure for lupus, and some people do die from the illness. So that's kind of like based a little bit on like a few years ago. Um, Now, like that's much less of a risk, and especially when you're seeing a rheumatologist, when you're getting help, which I'm finally able to do after all these years. So I'm just like beyond grateful. So, how does a person with lupus feel? You may experience pain and stiffness with or without swelling. This affects most people with lupus. Common areas for muscle pain and swelling include the neck, thighs, shoulder, and upper arms. And that is so true. So, my neck for sure, my shoulders, and my upper arms, which again, I 100% believe that that's why my handwriting has gotten so difficult, but it's gotten like so bad is because of the amount of stiffness that I have. And so it feels like I can't like freely move or like write properly. So sometimes when I'm reading my stuff, I do apologize. It's not intentional. I actually used to have really good handwriting. But when you have so much stiffness and stuff, sometimes it's like impossible. All right, lupus triggers overwork and not enough rest. For sure. So when you're, working or busy or doing stuff, just make sure to take rests. That's like the one thing I've had to learn is I can't go, 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 go. I can't be like, okay, getting the content ready and then, doing that, doing this. I have to like focus on one thing at a time, take a rest, and then do the next thing. And that's also how I like maintain my energy most of the time. Being out in the sun or having close exposure to fluorescent or halogen light. Well, this is an LED ring light, so I'm good. I'm just kidding. I have my windows open. Like I have like all like the sun. I have everything coming in here. Um, and for me, it's just love vitamin D. I love being outside. I love being in the fresh air. So yoga with Jenna is not going anywhere. Like it's still happening. I'm still gonna go for my walks. I just have to be more careful and kind of cover up more, basically. Another trigger is infection. So if you get sick, for sure that's a trigger. An injury, obviously because of like the amount of like inflammation, the swelling, all of that. um, Stopping your lupus medicines and other types of medicines. So, since I'm not on anything for lupus yet, I can't really say like, one way or the other. But what I will, at least from experience, but it just kind of stands to reason. Like, they have you on medication for a reason. I know oftentimes people are not medication compliant because they feel like, oh, it's not working, or oh, it's not this, or oh, blah, 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 blah. But it's so important to stay compliant with stuff that your doctor has um, prescribed you, written you, instructed you to do. It is, you know? All right. Um, if you have fatigue related to lupus, it may feel like you can't possibly get enough rest. Even if you sleep more, you may find, or let's see, you sleep more than you're used to, it may feel like it is never enough. You may find that it's harder to do physical and mental work. The effort needed to do everyday tasks can be overwhelming. So, while this may be true, that's why I have been able to, over, the last bit of time, even before I knew I had the diagnosis, like 100%, right? Because that just happened today. But I've been listening to my body and really recognizing, like, oh, okay, like I need to take a rest in between stuff. Like, I can't just do like all of these things at once, and then do like mass recordings or anything like that. I have to really want to, um, like, I have to be in a certain creative mode for my podcast. And like, there's just all these little things, right? So, focus on the one thing at a time, super helpful. Also, making a list of what I want to get done for the day, but not having it be like super crazy, super overwhelming. I don't usually put like time things on stuff, like where, oh, this has to be done by 12 or whatever. But I definitely do um, just, list some things that I want to get done that day. I don't make it too crazy or overwhelming. And so that way, like, I can stay happy and I can stay in that creative mode and that feminine energy. Um, and so that way, like, I just stay confident. When you're trying to rush through things and trying to get all of these things done that are important and are great ideas, that's awesome. But you don't need to rush it all in one day, I guess is what I'm saying. So definitely trying to keep myself from staying overwhelmed, or from being from being overwhelmed is, super important. And so this is why I have this. It's It's like ASMR of drinking coffee, but it probably sounded like a disgusting gulp. um, Coffee and caffeine may help lupus patients experience a lower prevalence of pretty much most of the symptoms. And that's usually if you're drinking between 154 milligrams and 377 milligrams of caffeine a day. So when I was doing like the research for this, I was like, what? So I made myself some coffee like quick. I was like, okay, if coffee helps or caffeine helps, like that's cool. Um, I still have my proclivity for soda and all that. I just don't do it every day. But that has caffeine in it. So, but coffee is obviously like a better like caffeine ratio, I think. Um Unless you get like one of those like super big cups. I don't do that. Yes, I do. Um the other thing too is like with exercise and all that kind of stuff. So I don't know if anybody has seen on Pinterest those Better Me ads. No, I'm not sponsored by them. um, but they like the majority of them are ads for their like wall Pilates stuff. I signed up for the somatic, so I'm doing like a 4-week trial. And what I really liked about it is that it has a really good amount of rest ratio in the workouts. It lists the workouts, tells you if it's like newbies or medium or advanced and stuff. I mean, it's really good. And then you also have the library of all these other exercises. So it's not like you're just getting your workout that's assigned to you each day. You're also getting like a whole bunch of other workouts, excuse me, that you can do and workout programs, and they all vary in length, and they talk about like what they target. I mean, it's great, right? So doing that, doing pliability as well to really like stretch out and limber up, especially when they have the programs for like your shoulder and wrists and upper body and stuff. Like that helps so much with loosening things up. Now, is it a cure all? No. But I just try to be as proactive as I possibly can and try to find solutions to problems before, they become bigger problems. Try to make something into the best that I can rather than see it as something so negative. And that's why I've been so accepting of this diagnosis, was because I kind of knew it was coming. Um, but I'm more just so grateful to be able to see the doctor that I need to see in order to be treated for this, because this has been going on for just so long. And yeah, like I am doing the things that I need to do to stay healthy as best as I can. I am low on potassium, so I probably need to eat more bananas and do all that kind of stuff or whatever. But outside of that, like I definitely try to keep like a good like work-life balance, and I definitely try to stay fit because I want my endorphins and serotonin like up, you know? Just don't want the serotonin burnout. All right. And then 90% of lupus diagnoses are in women aged 15 to 44 years old. So imagine this being like something that one of your doctors considered when you were 19, then when you were like 26, and now I'm 34. I'm about to be 35 on February 10th. Um, so like it's so funny, like I fit the like the right mold of the age, right? And it's just kind of a trip, you know? And I think it's interesting too, like that it is affecting people like so young or they're getting diagnosed so young. Um, and all I can say, because this is just based on my experiences, just keep on trying, just keep on going, you know? Be grateful for every day you have. I know how it feels to be in pain. Um, and for me, it's like, well, if I'm smiling and I'm being confident and I'm, you know, just trying to see the best of every aspect of this diagnosis, um, I feel better. You know, I feel like, okay, you know, I don't see this as a curse or a punishment or anything. Like I said, I've seen this coming. I'm just grateful that I finally get to get the help that I need. And I'm also just incredibly grateful to you for watching and listening, for um, understanding why this spoke so much to my heart and why it was so incredibly important to me to share and to talk about. Um, there's hope, right? There's always hope. There's always going to be hope. And this doesn't have to be something that ruins your life at all. You just have to, well, part of it is choosing not to allow it to, for sure. Yeah. So thank you so much, Wellness Crew, for watching and listening. Like I said, it would mean the world to me if you would like or subscribe or follow. It would just make my day. And I really enjoy making content for you. And I really appreciate you taking the time to watch this. And until the next video, thank you, thank you, thank you for all your support.